So look, I think we're all like different people in different walks of life are all sort of aiming towards this same thing. And like Silicon Valley, it's more called P4 medicine, and that's sort of how it came from those organizations, that are pushing that forward. Singularity University had a medical group, and they were really into P4 medicine, and then you've got the functional medicine movement, you've got integrative, and they're all sort of aiming at the same thing because it's actually kind of obvious that that's what's needed, right? Is that you need something that is participatory because you can't outdrug like chronic disease. And yeah, you can predict future disease, right? It's not just pre-diabetes, but there's pre-Alzheimer's, there's pre-heart disease, there's pre-autoimmune disease. And, if you have the right diagnostics, you can see, where you're headed. So you can predict, and then ultimately you can prevent those things by taking action now.
Welcome to the MindHealth360 Show. I'm Kirkland Newman, and if you, your loved ones, or clients suffer from mental health issues such as depression, anxiety, insomnia, poor memory, poor attention, mood swings, exhaustion, etc., I interview the leading integrative mental health practitioners from around the world to help you understand the root causes of these symptoms, many of which may surprise you and suggest solutions to help you heal. If you like this interview, please do subscribe and forward to others who might find it helpful. If you want further information, please go to www.mindhealth360.com or find us on social media. So James Maskell, welcome to the Mind Health 360 Show. I'm absolutely thrilled to have you because you are one of the real pioneers in the field of functional medicine, and you are not a clinician, but you are one of the movers and shakers and entrepreneurs and visionaries, I think, behind this movement. You've been involved in this, frankly, since its inception. You have an incredible personal story, and I just think, you have been one of the people who's really moved this movement forward and really helped practitioners develop their practices and made it more mainstream, made it more accessible to people. And you've really been a visionary. So I'm absolutely thrilled to have you on the show. And I'd love to discuss, so you've written two fantastic books, The Evolution of Medicine and The Community Cure, which are really brilliant, which sort of give an overview of, the whole sort of movement around functional medicine, integrative medicine, what they mean, the different types of functional medicine, integrative medicine, how it relates to other terminology, and what are the characteristics and how do you practice it well, etc. And then The Community Cure, which is your latest book, is all about sort of the power of community and how you can, how we can sort of multiply the effects by, practicing this in a more communal way, essentially, or collaborative way. So what I'd love to do, first of all, I will just introduce you and talk a little bit about your background. So you're the creator of this amazing movement called Functional Forum, which is the world's largest integrative medicine conference. You lecture internationally. You've been featured on TED-Med, HuffPost Live, TEDx, and more. You contribute to the Huffington Post, Kevin MD, the Doctor's Blog, and Mind Body Green. You serve on the faculty of George Washington University's Metabolic Medicine Institute. And as I was saying, you're the author of these two wonderful books. And so what I'd love to do is find out a little bit, first of all, how you got started in this, what drew you to it, and what do you feel have been your real contributions to the movement?
Wonderful. Yeah. Well, thank you for having me, and I'm grateful to be here. Yeah, look, I mean, I was the weird kid at school that had this medicine thrust upon me without it being my choice. So I had a chiropractor and a homeopath, and I didn't realize that that was not normal until I went to school and realized that no one else knew what those things were. And, I was speaking a completely different language. And, that was just, in the back of my mind for a long time. I was the only kid in school whose, mother insisted that she be called before I was given antibiotics. So somehow, my mother foresaw the downside risk of the overuse of antibiotics by 30 years with no medical degree. And I was like, how is that possible? Like what thesis is going on? What programming is happening? And that always, stuck with me, especially as you started to see things in the news, like there's an antibiotics crisis. We shouldn't be using it for everything at every time. And then I went to university. I was in the middle of sort of a rebellious phase where I thought my parents were insane and I wanted to be an investment banker and, make money. And just realized like in that phase of doing economics and health economics that in my lifetime there was going to be the destruction of every major society because of the cost of chronic disease. And I ended up doing my thesis on it and learning all about it and really seeing that, that, yeah, like you could see the line going up, you could see the exponential increase in costs, and that it was all driven by chronic disease. And I just had this sort of window into the fact that like I had had a very different medical upbringing without medication, hadn't taken any form of really of medication, hadn't taken any antibiotics, and ultimately just realized like there is another way. And along the way, I'm also staying in touch and continuing to have that sort of medicine and being in touch with people who are in that field. And after an intervention from the divine, should we say, in 2004-5, living in London and being an investment banker, I decided to quit, move to America, and start to get into the front lines of trying to understand, one, is chronic disease reversible? Like, where does it come from? How is it formed? How is it different from acute disease? And yeah, is it reversible? And that was the beginning of a journey that started now 19 years ago. And along that way, the first question is, yes, obviously it is reversible. And then the next obvious question is, well, how do we reverse it at the scale that it exists? And that's already taken 19 years. It might take another 19, but I'm here for it.
That's amazing. And so one of the things you point out in your book is really this crisis of health and the crisis of health care. And so we have, two big problems. One, we have this huge increase of non-communicable diseases, which, in the old days, we would be killed by viruses and bacteria. Now we're killed by chronic diseases, which are non-communicable, such as cancer, diabetes, cardiovascular disease, and which are eminently they're not treatable with a pill, essentially. So we have different pills to manage the symptoms, but really they're lifestyle interventions that really help these diseases and get them better. And I think, we're really confronted in terms of this global health epidemic with the failure of health care, in the sense that, we don't really have cures for these diseases. We just have sort of management and symptom management. And I think one of the things that you really identified early on was the power of integrative approaches and of functional medicine. And can you tell me, what was it about functional medicine and integrative medicine that sort of made you think, okay, this is really going to help with the current crisis? So, this crisis in health and the crisis in healthcare. And one of the things I just want to mention is that Mark Hyman, who is, as you call him, the prodigal son of functional medicine, says that your book essentially is, could well change the world. And I think, those are big words for one of the godfathers or the godfather of functional medicine. And so how was it that you, were you drawn to functional medicine, and how do you see it as sort of the key and the solution to this healthcare crisis that we have and the crisis in health, essentially?
Yeah, well, so, it was a journey. I learned a lot along the way. So the first thing I did when I moved to America is I worked in a clinic where I saw chronic disease being reversed. So that was the first step. And, it didn't happen in one session. It didn't happen in 3 months. Often it was 6, 9 months, but I worked at that location for 18 months and I saw people transform. I saw people who the first time they came in were in a wheelchair and then walked in. I saw people, get off their medication. So, I saw it was possible. And then I wanted to know, like, well, who else is doing this? Is just the one-off in this clinic in Georgia, or are there other people? So I took a job selling to integrative practitioners of all varieties. And, that really was the formative time of my career, because in a 9-year span, I saw the whole gamut, from someone doing Reiki in their garage right through to like an integrative doctor working in a hospital and everything in between. And there's like the different types of practitioners, the chiropractors, the naturopaths, the acupuncturists, what do they all do? How do they all work? How do they charge? What is the thesis? What is the language? And that was like really an incredible, learning experience. About halfway through that journey, I started going to conferences. I went to the Integrated Health Symposium in New York, and I first saw functional medicine being communicated. And the thing that I grabbed at that moment is that what was missing for the movement to be coherent enough to actually make the impact that it needs to have, no movement has actually succeeded to have that sort of like success without a common language and a common system. And like you could have, one of the reasons why I think integrative medicine was not successful early on, or continues to actually not be successful in a lot of ways, is that like the chiropractor and the acupuncturist and all these practitioners working together, they don't have any common framework or language. They're doing the same thing, right? They're actually all bringing function back to the body in different ways, and they have their different methodology to do it. But if you don't speak the same language and you're not, seeing the body the same way, or at least having some common framework, the doctor's confused, the patient's confused, teamwork is impossible. And so when I sat there and I watched first Jeff Bland, like I saw him speak, and I looked around and I saw medical doctors like wrapped in his attention, right? Just like really like eating out of his hand. And I was like, that's not something that I had seen before, because I'd been selling to all kinds of practitioners for a long time. And the MDs, there was hardly any of them that got it and were interested in it. But here was a guy who had their attention. And then I saw Christy Hughes lecture, and I saw her put up, the sort of the structure of the Institute for Functional Medicine's matrix. And I looked at that and I was like, hang on a minute, like here's a consistent structure where we could get buy-in from all different groups into this. As an example, one of the 7 pieces of it is structure. And so it's like, okay, if a clinic was running, or a whole organization or a hospital was running everything through this structure, and you did the intake and you saw that structure was the biggest problem, you could refer it to a chiropractor, and the chiropractor could do their thing and the whole team would understand what was going on. So it was like, I was drawn to the fact that here in this structure was the potential for a cohesive framework where everyone could work together and speak the same language, and you could have groups of practitioners work together with the patient at the center. And so, that journey started me thinking, functional medicine, I could see, was sort of starting to get some traction. And that was what led to the Functional Forum into the beginning of 2014.
And the Functional Forum, so tell us a little bit about that. I mean, you call it the largest integrative health conference in the world. Yeah. So how does that work?
Yeah, well, what I saw there is that, like, also watching that Jeff Bland lecture, I'm looking around in the conference and no one's videoing, right? It's like, we're all sitting here. And the whole plan for the whole movement to succeed is that the 5% that all of the people in the room are going to retain is somehow going to be delivered on Monday, and everyone's going to change their practice. And I was like, this is so unlikely that this is going to work. So the first thing was with the Functional Forum is, one, I wanted to make it like cool and sexy to be a functional medicine doctor, right? That was the first thing. I wanted to be aspirational, to be a functional medicine doctor. 2, I wanted to like deliver the content for free all around the world, so that anyone in the world could find out about functional medicine. If you go back to 2014, there's blogs and podcasts and all these kind of things starting to pop up, early blogs and podcasts, but they're all consumer focused. So there's literally no free content for doctors to say, this is what it is. So the goal was, how could we create free content? And then the goal was, how do we actually introduce practitioners who are interested in this to each other? I was a sales rep, so I'm going around, and I would go into a small town in Connecticut and I would meet a guy whose practice is all built around multi-systemic chronic illness, maybe like, Lyme disease, because Lyme's from Connecticut. And I'd be like, oh, do you know Dr. Smith down the road? He's also got this kind of practice. And they had never met each other. And I was like, this is insane. So the Functional Forum started as a way to introduce doctors in New York City to each other, connect them, create an opportunity for them to meet each other. And then we put on a show, and the show had some things to it. One, I didn't let any doctor speak for more than 15 minutes because I realized like it's boring. Like you can get everything you need to get across in 15 minutes. 2, we made it cool and sexy and aspirational. So we put doctors on stage who other doctors would think, I want to be like them. We had Daft Punk intro music. We did comedy stuff. We had live interaction. So we live streamed. Back in 2014, live streaming was hard. And so for the first 3 years, the whole thing was live streamed so that people around the world could watch it on the YouTube channel and could, tweet me questions, and I could ask the guests those questions. So there was a lot of things in the Functional Forum that had never been done before. And it was just the right thing at the right time. And the reason why it's the biggest, or it was the biggest at one point, is because we had 400 meetup groups around the world all watching the show together, and nothing like that had ever existed. And the goal was, the goal has always been and continues to be to this moment, how do you remove friction to adoption? And one of the big pieces of friction was that 99% of doctors had never heard about it. And if they had heard about it, their next step was a $5,000 conference that took 5 days off class. And I was like, no wonder no one's coming, right? We need to build up the stack of value so that we get more people come. And now you see over time, like now there's lead magnets and there's mini courses and there's all this stuff. But at that time, there was none of that.
Yeah, I mean that's yeah, and that's amazing because as I say, you're a total pioneer. What about now? I mean, do you feel that the situation now is that it's really, I mean, I know you share my view that it's certainly not mainstream yet, and it is not as prevalent as we would like it to be. What do you think are the barriers to have that happen?
Well, yeah. So look, on the good side, the good news is that, for many people's efforts, certainly not just mine, but now there is a functional medicine doctor in every little town in America. And if you seek out one of those doctors, you can find them and you can go and see them.
It's true.
Right. So that exists.
Yeah.
I would say what doesn't really exist is the fact that, like, in the rest of medicine, who pays for medicine in general? 80% of medicine is paid for by everything apart from individual people, right? Insurance companies, employers, health systems, whatever. That's who's actually paying for medicine. And we have not yet got functional medicine into a structure where it can be paid for by those organizations. We only have the beginning parts of that. And there's some really exciting things happening where some organizations have proved their outcomes, both clinical outcomes and cost outcomes, which is the most important thing, and are now able to sell to employers to say, hey, we've got proof that if you have patients with, massive, difficult chronic illness, that we can reduce the cost of care by 30%. And so those organizations now are growing substantially because they have proven what the rest of medicine is looking for, which is like better outcomes at lower cost generally. Now, that's not always the case in health systems because of the insurance stuff, but the majority of healthcare in the world is built by good outcomes at low cost. And we're starting to see organizations that 10 years started tracking properly are now reaping the rewards of those efforts. So there's still a lot of friction, right? So to be reduced, so the friction has to be reduced. It needs to be, the quality of care needs to be continually improved across all practices. It needs to be easier for one doctor to sort of share their knowledge with a new doctor. That's still very slow and not really that efficient. We need to have consistent outcomes, and the outcomes in functional medicine have been driven by the doctor-patient relationship, but that's very inconsistent. So some of the things that I've been working on is how do you create consistent standard of care with everything apart from the doctor's visits, with education, with coaching, community, curriculum. How do you create things that can be tested consistently in work? And so those are all the things that are in front of us right now. And ultimately there's still a long way to go. The functional medicine revolution has not happened yet. It is happening, but it's still nascent, and I think there's a long way to go. But I'm also proud of like what's already happened, and it's amazing to see like where these kind of conversations are showing up, and the fact that there is like a very large subculture of people eschewing conventional medicine and going functional and telling their friends and family about it. And that is what is supporting the sort of functional medicine movement today that is, fairly significant.
Agreed. And also, I mean, you were mentioning that, for instance, Mark Hyman took over, started the first sort of integrative medicine movement in a very established mainstream clinic, which was the Cleveland Clinic, and that they were tracking outcomes, I think back in 2016 already. And have they had good results, and has that grown? Do you know? Because they're presumably sort of the standard bearer of the movement in more mainstream practice. I know that I visited the Cleveland Clinic here in London, and there was no evidence whatsoever of any sort of functional medicine here.
Well, entry into health systems is interesting. It's its own story. If you look at it actually, so lifestyle medicine, which is sort of like a very simplified version where you're just literally getting people to do healthy lifestyle behaviors with none of the sort of sort of
testing,
sophisticated, sort of looking at how we got here, but really just adding lifestyle medicine into the standard of care. That has been very successful at growing. There's over 100 health systems in America that are actively adopting it. And part of that reason is that it's not as threatening to conventional medicine. Functional medicine is quite threatening because you're saying like, hey, these diseases that you're managing for years on end, these are reversible and you just don't know how to do it. And that is extremely threatening for a doctor. And it's one of the big friction points that we're seeing right now is that most doctors aren't trained in it, don't want to be trained in it, are threatened by its existence, right? So lifestyle medicine is having some success. Integrative medicine has actually had success too. So there's, the Academy of Integrated Health and Medicine. There are academic consortiums of integrative centers across many health systems, much more effective. Functional medicine specifically has not been successful at getting into systems. And I think it's because it is quite caustic, because it's sort of like, hey, we can do this better than you. And the functional medicine, the Cleveland Clinic is a great example. The Cleveland Clinic has been, something that I've followed very consistently, because in the 4th episode of the Functional Forum, the first time we got the streaming working properly, Mark Hyman came in, and I didn't even know he was going to do this, came in, flew in from Cleveland that day and announced the Cleveland Clinic. And that was kind of what should put our show on the map, because everyone was like, oh my God, this is big news for the industry. And I didn't know it was going to happen. And it was cool that we got it all on video. And then, we went there in 2018 and we sort of showed the center that had been built. And then since then, they've released some incredible data. So in 2019, they showed that functional medicine outperformed conventional medicine, and not just any conventional medicine like Cleveland Clinic conventional medicine, which is, gold standard. And then in 2021, they showed in the British Medical Journal that group delivered functional medicine outperformed individual functional medicine. And so like you start to see, that trend emerging, and getting early access to that data is actually what stimulated me, or one of the things that stimulated me to write The Community Cure, because I recognize that functional medicine, a big part of this friction conversation is functional medicine delivered in the way that it has been in phase 1, which is long appointments with, doctors with very specific training and knowledge, can only get us so far in the revolution, right? You can only end up treating a certain percentage of the population that are either very sick, very rich, or, very environmentally focused. They will never get beyond that. If we want to get into the rest of society, the middle of the bell curve, it needs to be delivered in such a way that's like economically viable for the, in order to be paid for. And I just saw that the group was the best combination of like economic viability and effectiveness, and could actually become the standard of care. And so for the last few years, I've been like moving that forward. And I have a business heal community that is like delivering these groups as a service to health systems to make it easier for them to adopt, this group methodology. But the journey continues, and there's still a lot of friction that needs to be resolved and to be removed. But I'm more hopeful today than I've ever been, and at the same time, there's more reality about like what does it actually take to make this kind of thing happen.
Well, also, I mean, you talk about the doctors being afraid of functional medicine, but it's also there's a business imperative behind it that creates a lot of friction. So, for instance, the pharmaceutical industry is probably afraid of it because their whole business model is based on chronic disease management, essentially. And so, it's very threatening to think that you can reverse chronic disease when your whole business model depends on it. So I think that's one thing. The second thing I'd like to talk about is, what are the key tenets of the approach? Because, you mentioned integrative medicine, you mentioned functional medicine, you mentioned alternatives, you mentioned all these different sort of approaches and the lack of a common language. One of the things that I find fascinating is that there is a common denominator that unites all these different movements and these different sort of fragments and brings them together. And if I'm not mistaken, all of them share a sort of root cause approach. First of all, it's all about finding and treating the root cause. And you mentioned the 4 Ps in your book, which I thought was great. So personalized, predictive, preventive, and then there was another one that I can't remember, but you can
participatory, the most important
one, the most important participatory. which is, you know, the whole revolution. Your GP is not, or your doctor is not God. He's not, you know, an icon. It's participatory in the sense that you work with them as an individual or her. And, you know, there's a collaborative approach between the patient and the practitioner. And so I think, you know, talk to us a little bit about these common denominators, which I think are across the board in terms of all these different sort of alternative or integrative or functional approaches. What do these sort of 4Ps mean? And you know, how would you add anything? One of the things that I thought was missing was this precision. So we talk now a lot about precision medicine and precision approaches. And you know, that could be a 5th P, for instance. So tell me about that.
Well, look, every word has the potential to be sort of, you know, lose its original meaning, right, by the overuse of it. And, you know, I agree, like, I agree that precision is a good word, but at the same time, if you do something that's both personalized, predictive, and preventive, it's pretty much precision, you know, by its nature because of all those other P's. Yeah, so look, I think, you know, I think we're all like different people in different walks of life are all sort of aiming towards this same thing. And like Silicon Valley, it's more called P4 medicine, and that's sort of how it came from, you know, from those organizations, you know, that are pushing that forward. Singularity University had a medical group, and they were really into P4 medicine, you know, and then you've got the functional medicine movement, you've got integrative, and they're all sort of aiming at the same thing because it's actually kind of obvious that that's what's needed, right? Is that you need something that is participatory because you can't outdrug like chronic disease. It's just not a fit. You know, they're just like those two things don't together. The patient has to participate, so that's it. And yeah, you can predict future disease, right? You could. It's not just pre-diabetes, but there's pre-Alzheimer's, there's pre-heart disease, there's pre-autoimmune disease, and you know, if you have the right diagnostics, you can see, you know, where you're headed. So you can predict, you know, and then ultimately you can prevent those things by taking action now. You can start to reverse and prevent those things by building function. And all of that is obviously personalized because everyone is the sort of combination of their exposures over their life and their lifestyle over their life. And so, you know, everyone's sort of honing in on this same concept. And it's just the question of like, you know, how, you know, what will be most successful in, you know, getting that to scale. I'm less actually interested in the words. I think it's important to have the right words because different words, you know, change meaning over time, especially as they're used in a lot of like marketing and so forth. So, you know, like longevity has come from nowhere in the last few years to be like a dominant theme. But ultimately, like, what does it take to live a long life? Well, don't die of chronic illness. Well, how do you do that? Well, you do functional medicine, right? And you actually get to understand why the body's breaking down and you rebuild the function so that you can live optimally. It's the same concept. It's just got a new word for it and it's a new way of thinking about it. But ultimately, what are we heading towards, Kirkland? It's just the truth. It's just the truth, right? It's just this is how the body works. This is how the body heals. Yes, it's complex. We have to have complex thinking for a complex object. You know, one thing I'll just say is that, you know, we've been so focused on forever. People say, well, it's about science. And one of the things that I just think is important to understand is that science was very easy to do in like the simple sciences like chemistry and physics, where there was definite answers. As soon as you take that same idea of science and you apply it to something as complex as the human body, it creates an opportunity for untruth to appear as truth for a long time. And I would say like a pharmaceutical first approach for chronic disease has been veiled through marketing and pharmaceutical efforts to be like the truth of how we do medicine, but it's nowhere close to the truth of how you create a resilient human body. And so we're all finding our way back to the truth, and we can call it whatever we want. But, you know, there's more and more people focused on the fact that, you know, creating a healthcare system that is true will actually, you know, will actually end up with, you know, healthy people who are capable and who are in the right mindset to go and solve many of the other problems that we have in the world.
100%. And I'm very interested in this community approach because, you talk about group medicine. So I'd like to find out more. What do you mean by that? How is it practiced? What are the benefits? And also the sort of slight paradox, because we talk about personalized medicine a lot in terms of, personalized medicine being the medicine of the future and being so important, having a precision approach and individualized. Isn't that a paradox, when you practice that in a group? So how does that work?
Well, I'm very glad you mentioned that because that is covered in chapter 2 of the Community Cure, and you can read about how it's actually not a paradox at all.
Okay.
So the first thing is, look, groups, like you mentioned earlier, you think that functional medicine is the root cause medicine, but what if the root cause is loneliness and disconnection from each other, right? And that is clearly a root cause. There's tons of science now showing that loneliness is worse for you than smoking 15 cigarettes a day, and that is the biggest driver of all-cause mortality, and we talk about that at the beginning. And so we need a cure for loneliness. And how do you write a prescription for curing loneliness? You have to bring people actually together into groups, and create new relationships. And so I first heard about the group visit model in 2013. I got really excited about it because I saw that, one, it did solve that root cause of loneliness, and two, that it was like economically viable. It could be run by non-doctors, and you had, instead of one doctor spending 16 patients worth of time with one patient, now you had one doctor spending 16 patients in one period of time. So it was like exponentially more efficient than what we had before. So you're solving loneliness. You're allowing the practitioners that were running groups at the Cleveland Clinic that got those great outcomes had no training in groups and no training in functional medicine before they started doing it. So the journey to get to scale is that much more effective. And yeah, the paradox that you mentioned is interesting. What I would say is that if you go back to the 4Ps, the number one most important one is participatory. And the disempowered patient cannot participate, right? And so in order to participate in individualized medicine, functional medicine, or whatever, there is a baseline level of empowerment and participation that you need. And if people don't have that, you can't expect someone with 3 kids, 2 jobs, and no car to start a functional medicine protocol. There's a baseline level of empowerment that's necessary to get the majority of people to participate in health. And that's what the group provides. So that's the first thing. The second thing is, what is personalization, right? When you think about it, you may think, well, everyone gets different supplements. But actually, what personalization actually is people solving their own problems in their own life that are unique, right? If you're drinking 5 Cokes a day, there's no supplement protocol in the world that's going to reverse your type 2 diabetes. So you need to work on not drinking 5 Cokes a day. That's like the underlying, thing that has to happen. But the person next to you who doesn't drink 5 Cokes a day, they may have other things in their life. They need to deal with their toxic relationship, or they need to deal with their job or otherwise. That is personalized medicine. That can happen in a group. And it's not, fancy supplements off the back of a lab test. It's literally people dealing with their own personal issues that are unique, and the group can help to do that. And I know that because I studied it to write this group. And I know that because I've been in a men's group for 5 years where I've literally seen it. I've seen men solve their individual problems by having the cohesive support of another group of men who are there for each other and are helping them on their own journey. That is also personalized medicine.
So interesting, because we know, for instance, that in therapy, even in trauma therapy, like group therapy is incredibly effective. And so, in emotional and psychotherapeutic therapies, as well as functional medicine, it's an incredibly powerful approach. Do you find, though, that the moderation of the group makes a big difference, or is it just the group dynamic? Because in sort of trauma therapy and psychotherapeutic groups, the moderation is very essential. I don't know if it's the same in functional medicine.
Well, moderation is interesting. I would say I have a lot of different theories on that. So one is we've run a ton of groups in lots of different situations. I would say that the groups that we ran in partnership with psychiatry clinics in Utah for treatment-resistant depression for people doing ketamine was a lot trickier to manage for a health coach, and possibly like we were on the edge of not being the right thing for that situation. So, because that was a unique population group, right? This is treatment-resistant depression, very sick people, and we really had to up our game to deal with those kind of people. I would say in general, health coaches are great people to run these groups because they are actually more like a peer. In the UK, you have the link worker, right? It's the same kind of idea with a social prescription, where it's like someone who's sort of been in those shoes and can execute on those kind of things. So like, I think that works well. I would say in my men's group, there's no leadership and no professional facilitation. And over time, like when I joined, there's like 6 or 7 of us in that group that have had significant objective improvements in their life, whether it be, repairing relationships with family members, spouses, whether it be, quitting alcohol, whether it be quitting, other substances, whatever it might be, right? There's been a lot of success in that group. More recently, we've had people join the group who I would say were on the path, or if not in the throes of mental illness. And even though there's no professional in that group, have had incredible strides very quickly because actually they didn't need drugs. What they needed is a supportive community to feel safe, to feel connected, and to go on a journey of self-discovery to understand like what is driving their physiology. And a lot of times it's psychosocial, psychospiritual stuff. So that's the cure. And that is the community cure right there. So I think all things are possible. In the Community Cure book, I talk about really what it is. It's about community as a structure and this sort of new medicine as the operating system and how those things come together. And some of the most exciting examples are not really medicine at all, like church groups and volunteer groups and groups of people cooking together and whatever. So I just sort of tried to showcase a range of situations where if you put those two things together in novel ways, magic occurs. And ultimately, that magic is available to anyone who wants to either participate in it or start something.
Now, in your experience, though, what I'm hearing with your work with groups is that, a lot of it is led by the psychospiritual, by the emotional, which then influences the biochemistry. Would you say that's accurate? And would you say that we should be using more almost top down, so sort of almost mental health approaches to physiological problems? Or do you think that you have to do both? Or do you think it's a case by case basis? Like, what's your view on that?
I think it could be individualized, but I think in general, we use the psychospiritual things the least and have the most impact. As I met functional medicine doctors over the last 15 years, it would be interesting. Like when a doctor was first trained in functional medicine, they would be all about the like lab tests and the supplements because it's the most similar to what they were trained on by and large if they're medical doctors, right? So they would be, they would have the patient come in and they would do the deep history and they would do all the lab testing and they'd be like, well, this is what's going on in your physiology. Let's fix that. But then if you go and see these more experienced doctors that have been doing it for 20, 30 years, what does the first appointment look like? It's like, hey, Kirkland, what's going on? Talk to me. What's happening in your life right now? Because they recognized that ultimately, like, the physiology is downstream of everything, right? It's downstream of the psychospiritual, psycho-emotional stuff that's happening, the relationships, the chronic, relationship stress, money stress, all these kind of other things. We just did a functional forum on men's health earlier this week, and it was the first functional forum that really wasn't about functional medicine. It was really about the psychospiritual crisis in men, right? And ultimately, what that's causing. That's what's causing the suicide, the loneliness, the depression, and there's environmental factors. There's even, evolutionary factors that are playing into men in that way. So I think that the reason I wrote the book is because I feel like we need to start paying more attention to this, and it can affect the physiology, but more importantly, it can affect the mental health. Like, and to your point and everything you're in.
James?
Can hear you. Can't hear me?
Hi, sorry, I lost you. So you said to your point.
Yeah, to your point, this really has the biggest impact in mental health, and ultimately, if we want to make a dent in mental health, these psychospiritual, biopsychosocial issues play a much greater role. And so I think it's critical to that. That was one of the reasons why I wrote the book, The Community Cure, was because I wanted to see more of this psycho-spiritual, psycho-emotional stuff being worked on. And the group is really the most, efficient way and effective way to be able to do that. And by the way, when I wrote this book, I had no idea, or hadn't done the research myself on things like polyvagal theory and safety and so forth. And now that I've understood that, I'm sad that I didn't know that ahead, because it would have been a really important part of that book, because ultimately that's what community is really doing, is creating safety. And now that I know it, I'm even more passionate to try and, reduce the friction for people to want to be part of groups. And so that's a lot of what I'm working on now, is to try and make it more cool and aspirational to want to be part of a group, so that many more people can get access to this level of therapy. Because at this moment, it's like AA, and people don't want to be part of those things. But I think that once people experience what it's like to be with a group of peers that are all getting healthy together, they recognize how profoundly valuable that is.
So if you look at mental health from your perspective, because it seems to me that you're sort of gravitating more in that direction, what do you think needs to happen in order to heal this sort of huge mental health crisis that we have? We have such an increase in suicides. We have teens who are completely depressed, have eating disorders, record numbers of suicides among young people. Some people say it's technology, other people say it's processed foods. What is your view, given your sort of overview, in terms of this mental health crisis that we're facing both in adults and in teens?
I think we're just moving towards the truth in the same way. It's like, yes, if you've always been, on the mental, emotional talk therapy side, you need to take into account the physiology. If you're really focused in physiology, you need to understand that point. And why are we both moving towards the truth of how the body works, the truth of how the body heals, right? That's the journey that we're all on. And so I think it's amazing, the pioneering work you're doing to bring mental health, into the physiological. And I'm excited to be part and push forward your conference and all the different work that you're doing, because I think it's mission critical. And, there's going to need to be some balance, some true, version in the middle that can get to scale and has all the advantages of what we've learned along the way. And I think that's what I see for myself in the next decade, is now that we understand that health is environmental and biochemical and psychosocial, right? Then how do we learn from what's happened in the last 10 years, and how do we create structures that can really take this to scale? And I'm excited about the future, because I see it just on the horizon.
Well, I was going to just ask you, and then we'll we've already been almost an hour, so thank you so much for your time. But I was going to ask you, so what are you working on at the moment? What are you excited about? And what's your sort of next big thing?
Yeah, so the Vegas Fest is a new thing that I started earlier this year. And the point of the Vegas Fest, it's a celebratory event, an education event, participatory education event around the vagus nerve. The goal of that is to find a way that practitioners from mental health all the way through to functional medicine can put on an event in the community to bring people into their practices and give people an actual experience of actually healing. So rather than just like learning about what healing could be and then either doing it or not, actually doing it. And I think that's critical. So Vegas Fest is up and running, and we have clinics across the country that are running this as a way to bring people into their practice and give them participatory education. So you can go to Vegas Fest, VAGUS Fest.com, and you can get all of the resources for free on how to put on an event in your community in a park, to give people an education about the vagus nerve, to have them feel what healing feels like, or the starting point of that, and then to ideally, make their way into your practice. And what a gift to give the community to like regulate their nervous system. And then, I'm really focused now on a number of things. One, I'm involved in a project to bring functional medicine at scale into an organization that is built around saving money. So I'm very interested in like identifying functional medicine services, tools, and other situations that have a proven ability to save money, and connecting them to essentially like an insurance company, something that is responsible for 450,000 Medicare lives right now in the US. And that's really exciting, because it's sort of showing that there is demand for care that gets people well, it gets people healthy. So that's really exciting. And then kind of what I was just alluding to there, I'm very interested in how do we make it a hell of a lot easier for people to do functional medicine. And if you ask me what I think functional medicine actually is, it's really the organization and prioritization of data, right? When you go to see a functional doctor, they do all these tests and so forth. The doctor then has to look at all that information and prioritize, what should I be doing first for this patient? How do I build the most function most quickly in the area where the function is the least? And I think that expecting that everyone can do that in their brains is one of the reasons why functional medicine has not got to scale. And I think there is more, there are solutions emerging to allow that to be done by a computer and allow the doctor to basically have functional medicine decision support that, one, will allow existing clinics to scale more quickly, and second, will allow newbie doctors to have a sort of an ongoing clinical mentorship to allow them to get better at functional medicine a lot more quickly. And so those are things that are like right for me right now, as well as, you know, things that I've been involved with. The Functional Forum still continues, and we have groups, and we put out the Functional Forum every month, and we have 2 podcasts a month that we put on, and we're still working on, you know, taking that group visit project to scale into health systems as well. So lots of different irons in the fire, but these are all significant friction points that need to be addressed. And I think, you know, one by one, we'll just knock them off. And I'm excited to be, you know, working with passionate, capable people like yourself. And, you know, I see good things on the horizon.
Well, that's amazing, James. Thank you so much. And thanks for everything you do for this field. I think it's, you know, super amazing. And I can't wait to see you at IMMH in Washington in October, where you will be having a Vegas Fest. And so people can come and try that.
Bring it back to something you said earlier that I just want to, you know, to estimate. You said that, like, you know, what you see is that a lot of these efforts have a lot of things in common.
Yeah.
And I just want to talk about that for a minute, because I think in order for this movement to really, you know, hit its potential, there needs to be a greater level of unity. And that's what we tried to do with the Functional Forum, with, you know, connecting groups and seeing eye to eye. And I just want to honor, you know, the work that you're doing to, you know, to see that first, and then to like actively work to create unity. It's harder than ever to create it, but it's more needed than ever. And I see that, you know, in the programming in the conference, and that's why I'm excited to be part of it.
And so it really is about constantly bringing people together outside of their silos. And I think you and I, being sort of journalists / health entrepreneurs, are able to have that sort of bird's eye view that's crucial in terms of not being in these silos, because I think that's so important to create this unity and this community and collaboration. So hats off to you. Yeah.
Thank you. Look forward to seeing you in October.
Yeah, so do I. Thank you so much, James. And how do people find you? So James Maskell, what's your website?
Yeah, jamesmaskell.com. You can look at me there. And then Instagram, Mr. James Maskell, probably the most places that you can find me most easily. And yeah, look forward to connecting.
Fantastic. Thank you so much, James.
Thank you so much for listening to the MindHealth360 Show. I hope that we've helped you realize that mental health symptoms have root causes that can and need to be addressed in order to sustainably heal, and have given you some ideas about steps you, your loved ones, or clients may take to start their healing journey. Please share this interview with anyone you think may find it helpful, and don't forget to subscribe to keep up to date with our latest interviews on integrative mental health. If you want further information, please go to www.mindhealth360.com or find us on social media. This information is for educational purposes only and is not intended to diagnose or treat any disease or to replace medical advice. Please always consult your healthcare practitioner before discontinuing any medication or implementing any changes in your diet, lifestyle, or supplement program.